8:30 now here on a Wednesday, and we have Dr. April Ritz in the house talking to us today from Effingham Pelvic Health and Wellness. Good morning.
Good morning.
I was getting ahead of myself there with the pelvic and
It's a mouthful.
flip-flopping the Effingham and the pelvic there together. So welcome to the show. You're on Facebook Live as well, and you've brought props in today for us.
Yes, I brought my handy pelvis so you
All
guys
right.
can see what I'm talking about.
Very good, very good. Of course, tell us a little bit about Effingham Pelvic Health and Wellness if people don't know.
Yeah, so I am the owner of Effingham Pelvic Health and Wellness. We are a physical therapy clinic, but we specialize in pelvic floor rehab and obstetric care, so pregnancy and postpartum as well. We have two other providers, including myself, Dr. Katie and Dr. Kyla, and we treat men, women, and children with any issues such as urinary leakage, bowel issues, abdominal pain, pelvic pain, constipation, back pain, hip pain, anything in that region. We treat it with a combination of exercises to working on the muscles and the imbalances we find in that region, as well as a lot of just education and health regarding bladder and bowel health and ways to improve. Also a big thing is like stress factors and sleep and all of that. So we treat the entire body. Our focus though is primarily on the pelvic floor region.
And
Okay.
and I'm kind of old school maybe, and maybe I don't always associate it, but it is help with men, women, and children. Not just women. That's kind of what I would tend to think, but you got ways to help everybody.
Yeah, so everybody just thinks that, well, and I think it comes from women having babies, and people just think, oh, pelvic floor issues come from having children. You're told to do your Kegels, and that's about it. And that's all people really know about that area is like, if there's some issue going on, just do some Kegels. And actually, that's what I kind of wanted to talk about today.
Very good.
Good. I think, though, you ought to have a nickname for it, April. If you're going to bring that display, that example, that model, I think it should be nicknamed Elvis.
Elvis the pelvis. Okay,
Yeah,
that's gonna be its name now.
There you
Elvis
go.
the pelvis.
In case you needed that.
Yeah,
So for those of you on Facebook Live, here's Elvis the pelvis.
there it is. Yeah, all right, very good. You mentioned Kegels, and should we be doing those?
And do we know what a Kegel is?
Yes, most people have no idea what a Kegel is.
There you go.
So men, women, and children, we all have the same muscles. They're just arranged a little bit differently for women and men. So the Elvis the pelvis here is a female pelvis. So if we look at the muscles, there's external muscles and deep internal muscles. And like I said, men and women have these muscles are just arranged a little bit differently, but these muscles play a huge role in bladder and bowel function, sexual function, support of everything, especially with like exercise and lifting heavy. These muscles have to work properly. And when we get these muscles either can become too tight, too weak, or a combination of both. And then that's when we start to have problems. So the question is, should I be doing Kegels? Because that's what everybody's told to do. No. Not
okay.
everybody should be doing pelvic floor strengthening and doing Kegels. So for those of you who don't know what a Kegel is, it is a pelvic floor contraction. So just like we do a bicep curl to engage our bicep muscle, you can do a Kegel to engage your pelvic floor muscles.
Okay.
So some of the cueing I tell people is think about trying to hold back your flow of urine, hold in a fart, just engaging those muscles, lifting kind of up and in, tightening them.
Okay.
And so like if you're sitting in your chair or wherever you're at right now, if you're driving in the car, you can try to do a pelvic floor contraction where you kind of squeeze up and in. Sometimes I also say picking up like a small blueberry or small marble with those muscles, lifting up. And it's a very gentle contraction. You're not squeezing your butt cheeks.
Okay.
So some people in my clinic do need to be doing those exercises, but many should not be doing it. So a great example is I had a new patient in this week. Whose main complaint is bowel leakage. And I asked her what she's been doing to try to help the issue. And she said, I've been trying to do those exercises, those Kegels, and it's not working. And she goes, maybe I'm not even doing it right. So we did the pelvic floor exam, and she is using those muscles correctly. But in her case, she shouldn't be doing those because her muscles are so tight and tense, and they were very painful. So
Okay.
for those of you that are listening, if you're having pelvic floor issues, because everybody wants to Google things and try to fix things themselves.
Oh, yeah.
So if you're having issues and Kegels aren't working for you, maybe you should come see our office. But the times I do not recommend Kegels is if you're having urinary urgency. So you're having to go pee a lot. You can't make it to the bathroom in time. You might even be having some leakage getting there. That is not a time that you should be doing Kegels. Some other conditions would be if you have like endometriosis or interstitial cystitis, because those are more painful pelvic floor muscles that are too tight typically with those conditions. Any type of pelvic pain, tailbone pain, pain with intercourse, those are all signs that we should not be doing Kegels.
Okay.
Because that's going to make a bad thing worse.
You've got it.
Yeah.
Yeah. So we have people come in and they're so frustrated because they're like, well, I've always been told to do these to help with my pelvic floor issues. And I'm like, ugh, we got to stop. Let's start fresh. That's why you're in here. We're just going to stop doing those now. And I'm going to guide you on the way what you should be doing to relax those muscles and help release that pain or urgency or whatever it may be.
Okay.
So I always say if you're questioning, if you're having dysfunction and you've been trying to fix it yourself and it's not getting better, just come see our office and be assessed by a physical therapist who's actually trained in assessing internal and external muscles. And if there is a pain issue, we take it very slow. We make everybody feel very, very comfortable. They're always in control of the situation. But we really need to figure out if we need to be doing strengthening or stretching or a combination. And so some conditions that could benefit from stretching and some from strengthening would be urinary leakage or bowel leakage, because you never know if it's too weak or too tight. Pelvic organ prolapse for women when their bladder, uterus, or rectum starting to kind of fall down. Erectile dysfunction for men. And then postpartum for women, everybody thinks postpartum, they're told in childbirth classes they need to be doing strengthening. A lot of the postpartum moms we see actually need to be doing more relaxation, especially if there's any like perineal tearing with birth and us working on releasing those muscles in that scar tissue.
I want to ask you something. This is something we've talked about in the past. Sometimes people think, I'm the only person that's dealing with this. There's only 2 people in the world, maybe. And that's not the case, is it?
It is not the case. And my patients like literally just get like a sigh of relief when I tell them, listen, you're not the only one with this problem. It's just a taboo topic and nobody discusses these issues. They're not openly walking around and saying, you know, I have smearing in my underwear or I pee my pants trying to get to the bathroom or I'm having pain in my marriage and can't have intimacy and can't like some of the people I see, it's really unfortunate, but their marriage is falling apart because there's no sexual intimacy because they've been dealing with this pain issue, whether it's the husband or the wife. Like men have issues too with these pelvic floor muscles, and I just want to get the word out there that it is okay for men to seek help for these issues too.
Okay. What are some of the symptoms?
Yeah, so symptoms of tight, overactive pelvic floor would be for women inability to have like a gynecological exam or use like a tampon because it hurts too bad. A ripping or tearing sensation with like sexual activity. Some women feel like they're always burning or on fire down there. Their skin feels raw, like razor blades. UTI-like symptoms, but their urinalysis is negative. Those are all symptoms of an overactive pelvic floor. And with those symptoms, I can tell you, if you have those, do not be doing Kegels.
Yeah. I mean, I've been doing them since we've been sitting here. So on the air, I'm doing Kegels right now. So yeah.
Your pelvic floor is going to be strong.
It is. Yeah, exactly.
You look better already, Brian. It's amazing.
Thank you.
And for men, it does help with like post-void dribbling. So some of the issues that men have is like after they urinate, they'll have like a few little dribbles after they pee. So doing some pelvic floor strengthening can help in those situations. But then again, some of those men also need relaxation. So it's really hard without seeing and getting the full picture and hearing the whole story of what you should be doing.
Very good.
Yes.
Very good. And the conditions that are always overactive pelvic floor need more stretching and relaxation muscles are what?
Some like vaginismus is a diagnosis. So that is just tightening or spasming of the pelvic floor muscles for women. Vulvodynia is another one, which just means pain of the vulvar region. And over 50% of women with this condition see over 3 healthcare providers before being properly diagnosed. So a lot of pelvic floor issues just go misdiagnosed for a long time. And that's something our clinic could definitely help with if you're having any pelvic floor concerns.
Very good. Very good. Now, again, like you said, it all depends on your situation. And each one, everybody's different. Whether to do Kegels, whether to do any kind of strengthening exercise at all, and that's where you guys come in. You guys can help them figure that out, I guess. Yeah.
Yes, yeah. So just one patient story I just want to share is we've had a lot of patients recently with urinary urgency. Peeing a lot, can't make it to the bathroom. Every time there's a bathroom, they're using it. They're always scouting out where the bathroom is. We had a patient come in, her muscles were overactive, too tight. We worked on releasing those muscles as well as working on like fluid intake, things like that, and getting control of the nervous system. But now she is going every 2 to 4 hours does not have to be concerned if there's a bathroom there or not,
Good.
and she's completely pad free. So
Good
that's
deal.
some like the I mean, those are some of my favorite stories. Women just like,
Mhm.
oh, getting rid of those pads, like not having to wear those every day and not having to worry if I'm going to an event if there's a bathroom there,
Mhm.
and or if I'm going to have to like leave the event to go to a gas station or something if there's no bathroom present. So
Yeah. And people, if they do want to get in touch with you, is what's the best way to do that?
yeah, so feel free to follow us. We'd love for you to follow us on social media, Instagram or Facebook at Effingham Pelvic Health. But if you are having issues and want to be seen in our clinic, we do not require a script or a referral unless you have Consociate or Health Alliance insurance. But you can just call our office. Our number is 217-705-5077. And we have on Facebook, we have a ton of upcoming events for this fall. So just quickly, I wanted to shout out for September 7th, we have a mama workshop in Pana. It is a 9 a.m. to 1 p.m. event. There's going to be a birthing center from like Bloomington there, a chiropractor, some lactation consultants. I'll be speaking on pelvic floor throughout the stages of being a mom. September 14th, we have a $10 workout class, which is a new thing we're doing at our clinic.
Oh,
So
okay.
Rachel Taylor, she's coming in and teaching a class for pregnant and postpartum moms. That is $10 and will be limited to 8 people. And then September 17th, we have a free event at the clinic, and Amanda Settle is going to be coming in and going over nutrition for moms, as well as nutrition for babies. So babies in the first year of life, starting to like adding in solids into their diet. So that is a free class that will be September 17th, and all of those can be found on our Facebook page, and you can register there.
All right. Very good. And of course, you guys are located where at?
We are 101 West Evergreen, so the corner by Builder Supply and Equity. Yeah, Blue Roof.
Yeah. Look for the blue roof, and it's right there. That four-way stop now.
Yes, and
Yeah.
we typically have our signs out with a little bit of humor on
Mhm.
them too. So we're located there on the corner on Evergreen.
Very
Evergreen
good.
and Fourth. You
There you
Yes.
go.
bet.
Yeah. Very
You bet.
good. So, well, Dr. April, thanks for coming in today.
Awesome. Thank you guys so much.
You're welcome. Always good information and helpful information.
Yeah, you bet.
Let's see what's going on community calendar for a Wednesday.